Welcome to the CETA Foundation's CES 2021 interview series. My name is Joellen Gray. I'm a principal at Gray Matter Advisory Services and a board member of the CETA Foundation. I'm here to welcome Ashley Washington, Director of Aging Initiatives at the Lutheran Services of America. So first of all, I was amazed to realize that the Lutheran Services of America is actually the nation's largest healthcare services and human services organization, and that 1 in 50 Americans actually benefit from your services. That's a pretty amazing statistic. Can you tell us a little bit about what they do?
Of course. So Lutheran Services in America, as you mentioned, it's a network of over 300 health and human service organizations. So we have an extensive footprint in caring for older adults. With over about 200 member organizations, we provide a range of services to older adults in about 1,400 communities across 46 states in the country. And really what we're doing is we're driving investment in innovative models of service that address these key gaps in care for low-income older adults to make sure that they can age with dignity and respect in the home and community of their choice.
So your focus is really on aging in place?
Yes, aging in place with dignity and respect, and aging in place could be in an institutional setting such as assisted living or independent living. It could also be in a home independently owned. It could be in affordable housing, but really the emphasis is on aging with dignity and respect.
That's fantastic. Well, we were actually thrilled to support your program for remote caregivers and the use of technology for those individuals in rural Minnesota and North Dakota. Can you talk a little bit about that program?
Of course. So we like to set with a visual of, imagine it's a cold January, you're a senior living alone in a town of 400 people, and your kids live out of state. Many people know the challenges of aging in America, but far less people are familiar with the challenges of aging in rural America. Rural communities have a number of unique challenges. These communities are largely remote or sparsely populated and very isolated from population centers and have limited access to healthcare. But these rural areas are rapidly aging. Outside of urban areas, about 20% of rural residents are age 65 and older, and these projections are only increasing over time. So we really have a unique opportunity to serve family caregivers in rural communities. These family caregivers are those who provide the care and assistance to their loved ones, and they're more likely to serve alone, serve long hours, report difficulty finding local and affordable services to help their loved ones in these communities with scarce resources, and they're also tend to neglect their own self-care.
Are they people that currently live in the same community, or are they people who have been transplanted because they're there to help? What is really the caregiver's personal situation?
We've seen a variety of situations, especially during the COVID-19 pandemic. Rural family caregivers who live in the same home as their care recipient, also those who live out of state, and even those who are supporting a loved one who lives in a facility that because of the COVID-19 pandemic, there were visitor restrictions and they had not been able to see their loved ones.
Wow, that's really fascinating. How does then technology help bridge that communication for them?
Yes. So remote caregiver, it leverages technology to support the rural family caregivers amidst these challenges. So what it does is the technology provides coaching, teaching, and encouragement to strengthen and amplify the role of family caregivers. Our program builds on the evidence-based model, Powerful Tools for Caregivers, which supports remote classes and coaching on self-care, managing emotions, self-confidence, and accessing community resources. It creates virtual caregiver communities and support groups to connect the caregivers to peers who are facing similar challenges. and it provides access and instruction for online essential services. So teaching them how to buy groceries online, fill out pharmacy prescriptions, etc., for their care recipient. So it's also been very well received. And we've seen tangible results in improving the lives of caregivers, which is very important. Nearly 90% of our participants reported the program reduced their stress of caregiving and also that their health and quality of life improved. And over 100% shared they would recommend the program with others.
Oh, that's fantastic. Does it also give healthcare information, like how-tos for certain physical or emergency situations?
Yes, so the technology really connects them to those specialists and their healthcare providers to be able to assist them with those situations. We've seen a number of family caregivers really need this technology access and instruction for care transitions when they have a loved one returning home from a surgery, and they need help learning these complex medical tasks like changing an ostomy bag. They need the technology to be able to really audio and visually show them how to do these tasks.
So help me understand the caregiver themselves. Do they tend to be significantly younger than the person they're caring for? Or are they roughly the same age?
We see a lot of caregivers of different ages. You know, it's amazing that 1 in 4 Americans serves as a family caregiver in the US today. So thinking that 1 in 4 Americans, really in the rural communities, we are seeing older family caregivers, those with less income, and also those who have less formal education. So their access to technology and familiarity with technology is also newer. And so this program has created a tremendous opportunity to reach this new audience.
So are you also then providing them with technology devices? Are you teaching them how to use technology?
Yes. Through the partnership with the Consumer Technology Association Foundation, we are able to provide them the technology devices and then also the instruction and technology assistance through our programs such as based on the model Powerful Tools for Caregivers.
Fantastic. So this has been an unusual year for many service organizations. How have you had to pivot and respond to the COVID pandemic?
Yes, it's the challenges of the COVID-19 pandemic. Our partners really worked hard to quickly respond and support seniors in rural communities and to make sure that our direct program support and programs were evolving in light of this landscape. So our partners in Minnesota, they shared that it took just 5 days to completely transition from in-person caregiver services to virtual classes and coaching. And that team has served over 300% more caregivers since the pandemic. This tremendous success, though, really is in large part due to partners like the CTA Foundation. Because of your early investment in technology for our organizations, our programs had experience delivering programs online before the pandemic. So when we were forced to switch to virtual classes, we were able to do that in a quick amount of time so that seniors were still able to access their services.
That's fantastic that you could pivot like that.
Yeah.
Did you add any extra stress to the organization and to the people providing the services to the caregivers?
It definitely did. We saw, as I mentioned, a big uptick in those who participated in virtual services. So this has really helped us bridge the gap within our communities to ensure that they are able to access virtual services. But it did provide a number of stress financially as well as emotionally on our staff who are providing these services.
Well, I know it's been hard, but it sounds like you're doing a really important service. So thank you so much for what you've been able to do last year and we'll probably do this year as well. So here we are, we're at CES 2021, and you're going to be able to see lots of new and emerging technology. Is there anything that interests you personally as well as for the organization?
Yes, we are so excited to attend CES Summit next week. Since the COVID-19 pandemic has really limited in-person services, one thing we're really excited about is wearables, particularly smart glasses. So one of our partners is actually currently preparing to deliver caregiver counseling through using Google Glass. We think wearables can help better connect older adults and family caregivers in rural communities to specialists so that specialists can really see a glimpse into the challenges in their home environment and ensure that there's optimal home safety for their loved ones.
That's pretty cool.
Yeah.
So where would people go if they wanted to learn more about Lutheran services in America?
To learn more about Lutheran Services in America, you can visit our website at www.lutheranservices.org, or you can follow our accounts on LinkedIn and Twitter.
And if someone is a caregiver and wants to access your services, how would they go about doing that?
They can also go to lutheranservices.org and they can look at our membership page to be able to find one of our member organizations nearest to them.
Great. Well, thank you so much, Ashley. It's been really a pleasure talking with you.
Yes, thank you so much, Joellen, and thank you to everyone at the CTA Foundation.
Well, it was our pleasure to help. And for those who would like to know more about the CTA Foundation, please visit our website at ctafoundation.tech. Thank you.